Welcome to the NTT Health and Wellbeing Podcast, a show exploring the digital transformation of our everyday welfare. On this episode, are physician house calls truly a relic of the past? Two NTT Data Services experts, Vice President of Digital Edoardo Tealdi and Industry Consulting Director Dr. Richard Swafford, examine how the COVID-19 pandemic enabled technological innovations that made it easier than ever for some to receive health examinations without leaving the house. Though obstacles to accessibility remain, advances in telehealth and care bundling create an exciting path forward for bringing healthcare home.
Rich, would you like to tell us a little bit more about what you do?
Sure. Rich Swafford, I am part of the NTT Data Services consulting team dedicated to our provider solutions practice, focused primarily on our products and services associated with the provider market.
Fantastic. Thank you, Rich. Let's dive right into the business problem here. So we're talking about health systems. They've been facing, of course, a serious capacity and staffing issues because of the pandemic, and further impacted by the expected, of course, increase in volume post-pandemic. How is this a challenge to health systems?
Yeah, as you said, the volume we've seen during the pandemic has been unprecedented. Obviously, health systems have been struggling just to keep pace with that. However, we are expecting an actual increase or slight increase in volume post-pandemic. And the reason for that is that a lot of consumers have put off, voluntary procedures. They've put off their normal care for chronic conditions, et cetera, because of the pandemic. And so that volume increase is expected. And unfortunately, hospitals and health systems can't build hospitals fast enough to keep up with the growing volume, particularly as we're looking at this post-pandemic world. Layer on top of that are staffing issues, right? We've all heard of the Great Resignation, folks leaving healthcare in record numbers. You pile those two components on, or those two elements together, and what you end up with is a real crisis from a volume and staffing perspective. And of course, this creates financial hardship on the health system. It has an impact on patient risk, and therefore it affects quality of care.
Yeah, indeed, it is a matter of quality, and the patient experience is just being affected. It's an absolute perfect storm, and I agree with you. We can expect a long tail of pandemic-related challenges, and with patients resuming care and final proceeding with elective surgeries. It's going to be really years before the system is back to some kind of BAU normalcy. And at the same time, most structural solutions, as you say, they won't be ready in time to address the challenges of today. So it seems that the healthcare industry has seen during this time an explosion in telehealth during the pandemic. And is virtual care sufficient to plug the gap to meet the capacity and staffing issues?
Well, as you're probably aware, virtual care has been around for decades. And what we've seen is an explosion in the use of telehealth and virtual care solutions as a result of the pandemic, which using telehealth did help to decrease those volume concerns. As part of that, though, both the federal and state government entities relaxed a lot of the regulation associated with telehealth. So provider credentialing, for example, is an example of where they reduced the regulation around that. And so the big question is once we get back to some form of normalcy, what's going to happen with that temporary relaxation of regulation? The other limitation as it relates to virtual care as it is deployed today is the inability to really put hands on the patient from the point of view of vitals, supporting diagnoses and ongoing care is obviously a challenge. And so the ability to support remote patient monitoring and device automation, if you will, around the patient is still somewhat of a struggle in some of the environments. One of the things that we're seeing is this move towards a combination of different virtual devices, IoT, Internet of Things, as well as other types of telemetry equipment in order to track and manage the patient in somewhat of a replication of the in-person acute environment.
Yeah, I agree. As much as with pretty much any other sector, the best silver lining of the pandemic has been this acceleration of innovation, right? And it's certainly one aspect is regulation has been simplified for the interest of the common good, and but also it's about creativity and it's about entrepreneurship. But the challenge, as you say, is more than anything else, is about data. Because you have data capture in a remote environment, you have the data integration between the remote and the hospital. But as you say, we can expect a good degree of cross-pollination between remote care and in-person care. That could be the most significant long-term benefit as far as pandemic consequences, and some of the innovation developed for remote care can make its way into the provider facilities, into the hospital care, and then it's going to benefit people longer term, and it's going to really blend the putting your hands on the patient with the innovation and the technology. Let's talk a little bit about the challenges. So if we look at the classic people process technology in the present, what are the top challenges and how can we overcome them?
That's a great question. I think the challenges cover a broad range of concerns. Technology being the first element, a basic element. Obviously, the device integration, ensuring that devices can communicate in a common language and move information back and forth in an effective way. The AI, the artificial intelligence elements associated with the care associated with those devices, et cetera. There's also there's a people issue here, and there's a couple of avenues that we have to deal with. The first is the patient, him or herself. What area do they live in? Do they have access to broadband? Do they have access to high-speed data connectivity? Is their home an effective healing place? Is it have enough clean air and water and all of the things necessary from a healing perspective? As well as, we have a certain amount of health equity concern here as well. Is the education level, the healthcare competency of the individual at home? Are they able to follow directions in an effective way, et cetera? Moving over to the other side of that is the staffing issues from the health system perspective. Do we have staff that are capable of doing potentially home visits? Are they ready to be treating patients in a virtual setting, purely virtual setting going forward? Those all become staffing issues from a health system perspective. We have regulation and regulatory requirements. We have business model considerations. Financially, is there a business model there that makes sense? Can we deploy this as a new channel of care and have it sustain itself or have it, be effective from a financial perspective? So there's a number of obstacles that have to be overcome as part of a hospital at home, care at home type of scenario. And really that's why we're seeing more of a slow progression in this direction. However, I do believe that we will see more and more of this movement as those issues are overcome and dealt with.
Yeah, I agree with you. And as you say, if I was going to summarize it into 3 or 4 bullets, the tech and the data integration are the first that you think about that I think about as a technologist, but actually they're probably some of the easiest to overcome. The connectivity in the home, so the venue. The home was not designed to be a healthcare facility, and it was not necessarily designed with the level of connectivity that's required to do this. Then regulation, legal liabilities, all the regulatory change. And then, as always, the most important one is just changing the way that people think. The people change is the longest one. It requires a lot more to change the way that people behave than to change a software. Another topic that we haven't talked about yet is, if we look at the solutions, if we look at moving forward, how are health systems addressing all these concerns and what are the strategies that we're seeing in the industry?
That's a great question. And what we're seeing, and we've been doing a lot of industry analysis, talking to a lot of large health systems about their strategies. And what we're seeing is a move towards what we call hospital at home or care at home, which essentially is pushing the patient to the home setting. There's a lot of evidence out there related to the improvement in outcomes as a result of this, the reduction in cost based on having the patient in the home setting. And so by moving mildly acute patients from the hospital setting to the home setting and then surrounding them with the necessary technology in order to monitor and track and to communicate effectively with the patient is in its early stages. We're seeing a number of health systems doing these, we call them experiments, around early stage health at home ecosystems. The challenge is, obviously, you can't do this eating the elephant in one bite, if you will. Most health systems are doing this in small bites. And what they're doing is they're starting with a certain population of patients or a certain diagnosis, and then they're sort of focusing on that diagnosis. We're also seeing this move towards what we call bundling. If you think about a particular diagnosis or disease type, you can bundle certain devices and certain technology around that patient and then deploy that in the form of a bundle. And what that does is it reduces the complexity, it reduces the cost, and it allows the health system to focus staff and other resources on that population wrapped around that bundle. So that's what we're seeing, that movement in the industry at the moment.
Yeah, I agree, and I feel the same. We're seeing the beginnings of a new ecosystem and a new approach to healthcare, and that's brilliant. Our experience also is when we engage in smart health initiatives, and we do quite a few, is we find that it's absolutely essential to have compelling, narrow use cases. So you want to focus on something, and maybe you want to bundle a set of technologies and innovations to deliver a clear use case that provides immediate value without boiling the ocean and can really improve the patient experience and solve a business problem. So let's explore a little bit more what you mean by bundles of services. Are you thinking more of the technology used in the home or something else?
Well, yes and no. So we're really talking about those elements necessary to move a patient from a hospital bed to a bed at home, right? That's sort of the consideration. So think about, from a technology perspective, the monitoring, tracking, the telemetry, the ability to capture data around that patient represents a technology bundle, right? So, for example, say an orthopedic patient, say they had hip surgery, the ability to monitor blood pressure and those types of things as it relates to their recovery in the home, that would represent the technology bundle. But bundles are more than just technology. Think about, for a moment, the care team wrapped around that patient, whether they be virtual, whether they be visiting the home. That care team can also be bundled around that particular state that the patient is in. And so the bundles refer to technology, they refer to staff, but they also refer to billing and cost. More payers or health plans, if you will, are looking at paying for funding home care or health at home types of solutions. And so what we're seeing is you also bundle payments and reimbursement around that patient in the home setting as well. So again, the idea of bundles is to create a simplified mechanism for taking care of the patient with equivalent quality of care in the home that they would have received in the facility. And again, bundles represent a mechanism for doing that.
That's fantastic. It is inspiring. And this is about the ecosystem, right? It's leading towards an ecosystem for patient care with shared data, real-time decisions, maybe predictive capabilities, and ultimately it saves lives and it improves the patient experience. And the real big value is when the approach, as you say, is scaled and is made much more holistic. So you can treat an entire condition and you can put together lots of technologies, lots of innovations, and a blend of in-person care and remote care to really make a difference to a particular condition. Fantastic. Well, and looking ahead, so if we're looking ahead, I mean, historically, care was delivered in the home. Physicians and nurses would go to the patient and deliver care one patient at a time. And that was the 19th century or the beginning of the 20th, and then things changed. Do you think we're ultimately heading down that path in the future, so that the future is going to look a little bit like the past plus innovation?
Interestingly, at the beginning of 2020, I would have said no. But given the experience we've had with the pandemic and the rise in virtual care and the comfort level with a patient at home, I would say that we're likely heading in more of that direction. And I'm not suggesting that we'll go back to the small town doctor with his or her black bag going to visit a patient in the home. But I am suggesting that with technology and with the ability to do not just virtual care, but to wrap that technology around the patient, this really represents adding additional channels of care to a health system. And so ultimately, I think what we're looking at is that we're looking at delivering care more where the patient is. An interesting side effect of the pandemic has been that health systems have had to adopt new technology. They've had to build new mechanisms and new processes for treating patients, for taking care of patients remotely and in their facilities. And we as consumers, we as patients, all of us have recognized that healthcare can do this. And so now our expectations of the healthcare system are higher than they've ever been before. And I think through those technology systems that we have available to us today and that we have recognized that healthcare can deploy, I think we're going to move more and more in the direction of healthcare serving consumers versus sort of dictating to consumers. And so ultimately, I think what we're going to see is we're going to see more care delivered in the setting that we as consumers, we as patients are most comfortable with.
Exactly. And if you think about it, it's absolutely logical. And it's the same that's happening in pretty much every other sector. We're seeing the same journey in so many aspects of life. And it's been, of course, massively accelerated by the pandemic, by probably decades. And innovation and technology are reaching sort of a tipping point where movies have come to our homes and cinemas are closing. Work has largely come to our homes. Shopping has come to our homes, to the consumers. And it's only logical that healthcare is kind of doing the same because the experience is better. It's more efficient. It's more efficient for everyone. So both the patient and the provider can benefit from it. And ultimately, it makes lives better and more efficient. Let's talk a little bit about specific use cases. So let's make this real. Care at home. Care at home now, care at home 15 years from now. How do they differ in your mind?
Well, so let's define that just briefly. We see that there's three legs on this stool. The first is hospital at home, which is moving patients from an acute setting, hospital inpatient setting, to a home setting with all the necessary bundles that are required. Care at home, which we see as being preventative care, more around reducing the risk of the patient having long-term health issues. And then there's health at home, which we see as well as being chronic condition management, diabetes, hypertension, those types of chronic conditions. I think each of those three have a really different future-facing view. I think health at home and care at home, prevention and chronic condition care management have really strong future implications. In fact, we're doing some of that today. If you think about, for example, for diabetic care, we have the implants, where somebody can use their cell phone to check their blood sugar levels. We've got the ability to push that data back to a provider to track and manage. Same with hypertension and blood pressure checks and those types of things. So those two legs of the stool really lend themselves more effectively to a future state. And the devices, the IoT devices that are out there, think about the Apple Watch and those types of things that really are designed to track telemetry for those types of long-term care. The one that is more, I think, challenging is the hospital at home. And the hospital at home really is representative of, again, moving an acute patient from the hospital room to the home setting. That really is where the majority of our challenges come into play. And if you consider wrapping all of that care around that patient at home, the future state says we can expect to see more of that because all of the numbers, all of the outcomes, all of the financial considerations all point to improvements. Healthier patients, less folks, losing folks in the hospital setting when they're at home, those types of considerations. Again, the challenge is as technology advances and improves, a lot of the obstacles from a technology perspective will be overcome, but we still have to overcome some of the other challenges, obviously. And so I think from a future perspective, we're going to see, I would estimate, probably 80 to 90% of preventative and chronic condition management moving to the home setting, while we move more slowly in the acute hospital at home type of a scenario. That's sort of, I think, where we see the market going, where we see the industry moving. And in 15 years, we may be completely home-based. I don't think that'll ever be 100%, but I think there's an opportunity to move more and more of that patient care into the home setting.
Well, thank you, Richard. Thanks for the chat.
Thank you, Edo.
Thank you for listening to the NTT Health and Wellbeing Podcast. For additional resources and to continue this conversation, please visit www.global.ntt/health and wellbeing.